It's really, I had been looking at the audience and I commented to Sandra, what a treat, to have a primarily young audience, because you are the present and the future. There is no question about it. So it's just wonderful that you came and that you are giving up your Saturday to be with us. What I'm going to be doing along with Sandra is kind of provide you a very quick, I hope, overview of the Latino Physicians Needs Assessment Survey, a survey that strategically the Latino Physicians of California decided to do, because we wanted, if we are to implement the mission, it is very clear to us that it is important to have a finger on the pulse of what are the needs and concerns of Latino physicians. And this is really a team effort, let me tell you. I'm very proud to say that. And we team up, for example, with John Fogley, who is the lead of Centennium, which is the survey firm that helped us with this effort. Thank you, Juan, for your help with this. The other thing that I want to mention is that Leah, has been really an incredible force, a dynamo, I would say. Oh, okay. Can you hear me better?
No.
¿No? Okay, we try. Ahora sí. Ahora sí? Muy bien. So Leah really is the person who got us, the resources. We limited resources to implement this survey. And I want to recognize also the role, key role that Jose, as our chair of LPOC, had, and also the other board members. And if you may, can you stand up, the board members, so we can recognize you? I see Rick Baker in the back, and I see Efrain, Connie Casillas, and it's likely that some others. Oh, I'm sorry, Faustina. Yeah, Tina Navarez. Yeah, thank you so much. All of them, actively participated, contributed to making this report that you have in your, if I can only find it. Yeah, right here. This report that is in your folders, okay? And also you have a policy brief. That is kind of a summary, a more summarized version of the report. So I'm just going to go very quickly highlighting some of the findings, and Dr. Hernandez is going to complement that with, put it in context. So here we go. Let's see. Just to give you kind of a quick overview of the process that we went through in order to have the report that you have in your hands today. It was a process. We produced a proposal back in 2012 that, we kind of went back and forth with Centennium. And then from there, we did a very comprehensive lead review. And in a couple of days ago, again, I look at whether there is a previous survey of Latino physicians, and no, I wasn't able to find anything. So this is the first study done, certainly in California. One of the things that we did was to, in order to come up with the questions and the themes the topic areas, we did some board interviews, the LPOC board interviews, also interviewed some thought leaders across the state. Then we did a couple of focus groups with physicians, one in Oakland, one here in the LA area. And from all of this information, we ended up creating a survey that we implemented from September to November of last year. And then very recently, this month, on the 14th, we had a press conference that had many media hits. Very pleased to say that. And that's when we officially launched the report. So, let me see. It's a little bit. So this is the methodology that we use for the report. It is a mixed methods. We did some qualitative as well as quantitative. In the qualitative, we did the interviews and we did the focus groups. In the quantitative, we created the survey with several questions along specific topics that I share with you in a minute. And then from the survey, we did emails. It was through web-based. We also sent some paper versions by mail, and also did some telephone reminders. We collected some surveys also in a Latino health conference that LPOC has been sponsoring, and we took the opportunity, because it was right during the time that we launched the survey, and collected some interviews from that as well. So we had a total of 268 responses. That makes it through email a response rate of 17%, which is not that bad, let me tell you, for this kind of surveys, even though it is not what we would love to have. Given the resources that we had, limited resources, we thought that it is still a good response rate. In terms of the mailings that we did, just so you have a sense, we sent through mail 200 paper interviews, and 11 were returned by the U.S. Postal Service, and we ended up having 189. Out of the 189, we only got a response rate of 6%. And we included an incentive of how much money we put in it was $1. That was the incentive. And as you can see, it makes a difference. If you put $1, there is a higher percentage there. So the purpose of the survey is very simple: to better understand and assess the needs of Latino physicians in California. And just to give you a sense of who comprised the respondents of this survey, the greatest majority were Latino, although we had a few from Asian descent, primarily Chinese. 4 of them. But the greatest majority are of Mexican origin. But look, South Americans were second, followed by Puerto Ricans and Cubans. This is an interesting, statistic, because here in California, people of Mexican origin is a little over 80%. So there is an interesting distribution here. In terms of the languages, a great proportion of those who responded, basically 90%, are fluent in Spanish. But they also speak other languages as well. And they are fluent not only in written, but also verbal Spanish. The other thing is, in terms of gender identity and sexual orientation, majority were male, and the greatest majority, 90%, heterosexual or straight. These are the topic areas that we came up with through the process that I just mentioned to you. One is health advocacy, health education and prevention, workforce and training programs, mentoring, working within the ACA, and also organ donation. We have a member of the board who is passionate, Dr. Waldo Concepcion from Stanford, is passionate about this particular topic, and it is interesting what we found. In a minute, I'll tell you more. This is health advocacy, just to let you know that these are the questions and these are the answers and the mean. We use a Likert scale, 1 through 5. And this is the highlight. 90% of respondents emphasize the importance of collaborating with other medical associations to do these 3 things: to promote health careers for Latino students, create awareness for Latino health issues, and to promote healthy living among young Latinos. Prevention emerged as a very important focus area in the survey. Second, the health education. These are, once again, just to give you a sense of some of the questions with some of the answers. And this is the highlight. 80% of physician respondents indicated that LPOC has a role in raising awareness about healthy living and advocating for preventive health care for Latinos as well. So prevention, once again, it is a key area. I wish to have more time to put this in context, because I have done my adult life studying migration and health, and I can tell you that we Latinos have a very, very limited access to care. And once we get into the door of services, utilization is an issue as well. There are studies in mental health, for example, that up to 75% of Latinos don't return for a second time once they make it into the doors of service. So there are very challenging issues. So prevention is of critical importance. We know that in terms of chronic health conditions, 75% of them can be prevented. If we were to know how to communicate appropriately, and in ways that leads to behavioral changes. So this is in terms of health education. I mentioned that already. Mentoring. This is the highlight, that over 90% of the physician respondents indicated the utility value of mentoring. One is to increase leadership skills, and the other one is increase the success of Latino medical students. But look at this, a small percentage of the physician respondents were interested in participating in being mentored or participating in mentorship programs. But they gave us a directive for the Latino Physicians of California to do something about mentorship. Dr. Efrain Talamantes is going to pick up that topic. This is one of his passions, and along with the panel that he's going to be participating in. And he's our legacy leader of the Latino Physicians of California, and the creator, along with many of you who are here, of Mi Mentor. Work-life balance, and this is the question that we posed. I would be interested if the LPOC would offer the following benefits to help me manage my work-life balance. The response that got the most, the highest percentage is to do seminars. Seminars this would be considered to some extent a seminar, to give the word out about this. In terms of Affordable Care Act, we have, are you a provider for an IPA, medical group practitioner, a practice partner, or other? And the majority, 76%, and I will highlight that in a few seconds. And have you been included in a provider network? The greatest majority, 74%, said yes. So the highlight is what I just mentioned to you. Affordable Care Act again, what percentage of the newly insured in your practice is Latino? And you see the pyramid there. The mode is about 20 to 30%, with almost 17%. And also that your practice network have sufficient Latino providers. The greatest majority, 3 out of 4, said no. So 78% of Latino physicians reported an insufficient number of Latino healthcare providers. And this is, in terms of Affordable Care Act, that your medical practice need more Spanish-speaking personnel. 60% said yes. In terms of organ donation, how often do you discuss organ donation with your patients? 44% said never, 33% said seldom, so 3 out of 4 are in these two categories. And this is a critical issue because we Latinos need transplants as well. We really need to contribute, to organ donation, and unfortunately this is a gap, an important disparity, and much more education needs to be done. Especially from us, physicians who are in the, line of providing services. How often do you ask your patients if they have designated themselves as organ donors in the driver's license? As you can see, never, 26%, and seldom, 48%. Once again, there is a significant gap. And we really need to endeavor ourselves to, turn this around and do our fair share in terms of organ donations. Retirement plans, this is fascinating for us. 39% of Latino physicians are planning to retire in the next 10 years. And this is critical. If we already have a very low number of Latinos. Dr. Arevalo presented the incredible disconnect between our distribution in the population in comparison of how many of us are. Only 5% here in California. And 40% will retire in the next 10 years. It is going to be almost impossible unless there are things being done to increase these numbers. I know that some medical schools, in the UC and the other 3 medical schools, are trying to do some things, but it is not sufficient. We will collectively need to do much more to replenish what is expected to be depleted soon. We know also that about 40% of the workforce of physicians in general here in California are planning to retire in the next 4 years. These are the baby boomers. So this is a significant issue that we collectively will have to tackle. So what are the next steps? First, to improve the response. We will love to follow up with this. We need to improve the response rates, hopefully having more resources. I'm sure that if we were to have more resources, we could do much more, Juan, don't we? Measure trends. We would love to, now that we have a baseline, to see how this is moving. Implications that are included in the report. We just describe implications with each of the key findings, but we didn't include recommendations. One of the things that we're hoping to do here today is to engage with you to come up with some recommendations given some of the findings that you can see. So in the next few minutes, we would like to go back to you and get your comments and engage you in having some of your recommendations. And this is to set the tone for the rest of the day, because we would love to, in every single session, to engage you to have some of your input about this. And then we, of course, would love to implement the recommendations and also evaluate those efforts. And with this, just to give you, I was asked by OSHPID, Linda Onstad, who is the director of this office of the foundation, to bring to your attention that you can, some of you, or all of you, of course, can apply for that money through this loan repayment program, and the deadline is December 1st through February 28th. I know, Leah, we have some flyers about this as well?
Yes, they should be in their package.
Oh, okay. Those are in your package. And HOSPID also provided us with some resources to do the report. And with this, I would like to pass it on to Sandra Hernandez, the President and CEO of the California Healthcare Foundation. I will set you up.